from us is
Hey guys, this is Matt for Creative. I started a video at the very last minute because I hear there's a key point here that they are talking about doing a stimulus package for the people. And short story, they just mentioned, and nothing is finalized, $1,000 by check. They say they have other ways they can possibly do it, but let's watch the video here already in progress.
We have ways of getting money out pretty quickly.
Hey guys, this is Matt for Creative, and right now there's a presidential address, and it's being streamed, I think, by USA Today as well as other places. They're actually talking about the package that would give money back to individuals. They mention sending checks of $1,000 to people. This is ongoing right now, so I'm going to be having my reaction.
This is stuff that needs to be done now. The president has instructed me that this is no fault to American workers. For medical reasons, we are shutting down parts of this economy, and we're going to use all the tools we have, as I've said, and what tools we don't have, we're going back to Congress. I got to go back to
$150 billion to those who might be concerned that's too expensive.
We don't want to talk about it, but it's a substantial number. We're going big. The expression, we could do it two ways. We could keep going back every day or every week. We're going big, and that's where...
So instead of smaller checks, they said there's about 4 different ways that they could do this. They're going to be sending a large package out to people and small business owners too.
Every couple of days. We don't want to do it that way. We want to go big, go solid. The country is very strong. We've never been so strong, and that's what we're going to be doing. We don't want, with this invisible enemy, we don't want airlines going out of business. We don't want people losing their jobs or not having money to live. When they were doing
they were talking about this being worse than 9/11 for the airplane industry, and that's true because of the travel ban. But of course, other industries are being hit hard too.
In addition to airlines and hotels, you had a call with restaurants today. Was any type of emergency assistance discussed on that call? A lot of restaurants have to close. Even if they are doing delivery, they're not making as much money as they would with a full house.
Let me make 2 comments on the restaurants, and the president understands this. This was emphasized this morning. First of all, we want to make sure that the states allow the drive-through portion of these fast foods to stay open, particularly in a time period where we're telling people don't go.
So this actually works in some cases, but let's say in New York City, a lot of the places would have to be doing deliveries. They would kind of have to eat the cost of deliveries, since I've seen a lot of national chains like Chipotle, they've reduced or they've cut the delivery fee, but that still means that there are the people who actually have to make those deliveries, prep the food, you make your order, they deliver it to you. Where's that money going to be coming from? I'm guessing that's where this package is going to help out.
They will be able to feed a large part of the population. And in regards to support, I will say a lot of these businesses are small businesses, are companies, franchisees, 500 or less, and we have a specific program we'll be unveiling that helps all businesses, small and medium-sized businesses of 500 and less.
There's also a question regarding Marriott Corporation. It announced that it is furloughing thousands of individuals because of the impacts of the coronavirus. Will your legislation help those individuals?
I hope so. That's one of the reasons why we got to act very quickly, because we understand whether it's the airlines, hotels, for good reasons, to protect the United States on medical issues. These businesses are shut down, and the president wants to make sure, as I've said, we will use all the powers we have. You saw this today, $1 trillion of potential liquidity into the market, and the powers we don't have, we're going to Congress, and I will say there's a lot of bipartisan support for these issues. So I'm going to apologize because I have to...
You know what's interesting? If everybody's expecting checks in the mail, that's going to be a huge influx of mail, but also what is going to happen when people know, hey, there's going to be a check in every single person's mailbox? That's pretty... I don't know what to think about that.
September 11th, the only reason why the markets were closed was because the technology was disrupted. I've been on the phone with the major banks, with the New York Stock Exchange. Everybody wants to keep it open. We may get to a point where we shorten the hours if that's something they need to do, but Americans should know that we are going to do everything to make sure that they have access to their money at their banks, to the money in their 401ks, and to the money in stocks. So I want to just be very clear. we intend to keep the markets open.
And the banks are record-setting strong, so we have that, which is a much different event than what we had not so long ago. John, go ahead.
Mr. President, you mentioned the Army Corps of Engineers. You've had a conversation with Governor Cuomo. He believes that New York is going to run out of hospital beds. Are you prepared to mobilize the Army Corps?
We've been asked to
increase capacity?
Yes, we're starting to. We're starting the process, and it's a process. We hope it's not going to be necessary, but it could be necessary. The state is working on it very hard themselves, but we'll probably supplement what they're doing.
And given that many of the precursors for our pharmaceuticals come from China, and there have been supply disruptions, that supply chain has been broken to some degree. Do you expect that we could run into a shortage of prescription drugs?
No, I don't see that at all, and I think China has every incentive to make sure that things work well. China wants to make sure that things work very well. They have every incentive to do so. John?
Mr. President, the governor of Ohio has called off the election that was supposed to happen today, the primary election. Do you agree with that decision, and what steps are you taking to ensure that elections going forward, if this pandemic continues, that elections will be able to happen, including, of course, the big one in the fall?
Well, the governor of Ohio is doing a great job. He called that off, and we'll see what happens. There's a court case, and it hasn't been fully determined yet. But if he called it off, I could understand that, because he's definitely somebody that knows what he's doing. We'll be seeing what very soon. They're going by the rule of 10 as opposed to 50, and that's pretty tough. I would say probably you could violate that if you wanted to for an election. I just think an election is a very special thing. He's going to choose a different date. I think a date sometime in June. But that would be a decision that would be made by him. He felt it was necessary. The courts somebody's challenging it, so the courts will ultimately decide.
Well, what are you doing to ensure that further elections, if we're still in this situation a month from now, 2 months from now,
what I'm doing, John, is very simple. We're getting rid of this virus. That's what we're doing. That's the best thing we can do. By the way, for the markets, for everything, it's very simple solution.
Actually, considering elections, that may be an issue. So we have to start thinking about, do we actually maybe do things remotely, and how secure would that be if we get things sent to our phones?
Much larger, because we're a much larger country. We don't want to be there. And I think we've done really well. I think we've done well. I think the states have done well. We're all working together. The best thing we can do is get rid of the virus. Once that's gone, it's going to pop back like nobody's ever seen before. That's my opinion. But I think it'll pop back like nobody's ever seen before. Please.
Mr. President, just to follow up on John's question, specifically how many new hospital facilities could the Army Corps of Engineers build? And also, what specific measures are you taking to try to increase the number of ventilators in the stockpile?
Right. We've ordered massive numbers of ventilators. We have, by any normal standards, we have a lot of respirators, ventilators. We have tremendous amounts of equipment, but compared to what we're talking about here, this has never been done before. And yesterday I gave the governors the right to go order directly if they want, if they feel they can do it faster than going through the federal government. Now, we've knocked out all of the bureaucracy. It's very direct, but it's still always faster to order directly. And
yesterday they kind of made this whole issue of Trump was not going to offer the states any kind of help with getting the ventilators. In this case, I do agree a state would probably be the best place to get their own, like they have their own supply chain. Best idea, but of course the federal government should help with that.
I know the governor of New York has asked us to look at the Army Corps of Engineers, which could perhaps renovate existing buildings. But the president also has us inventorying what you all would understand as field hospitals or MASH hospitals that can be deployed very quickly. We spoke with Governor Inslee yesterday in Washington State. We have resources in that part of the country that we can move. And as governors make these requests, we will process them, bring them to the president. But there are two different lanes that DOD can provide, in addition to many medical supplies to augment our national reserves. And the president has tasked us to evaluate, make available, and to consider every request from governors for either field hospitals, expanding facilities, or the Army Corps of Engineers that could retrofit existing buildings.
The Army Corps is very prepared to do as we say, and we're looking at where it's going. But and they do call them MASH hospitals, but the field hospitals go up very quickly. We have them. We have all of this equipment in stock. and we're looking at different sites in a few different locations. Now, we're not going to need them in West Virginia, where so far I guess they have none. Still none, right? West Virginia.
No case.
Big Jim, the governor's, he must be doing a good job.
Or is that just reported?
That's what's reported.
No, but is that a reporting issue, or is that they have no cases?
Well, that's all that, I just see West Virginia is the only one that has no cases. So obviously that's being treated differently than in New York or California, different parts of California. I do say this though, the Army Corps of Engineers is ready, willing, and able. We have to give them the go.
New York City is a city. I mean, these are major cities. West Virginia is a much more rural area. Treatment there would be completely different than anything here.
A number of the governors. Governor Newsom has been very generous in his words, and I'm being generous to him too, because we're all working together very well. And I think a lot of very positive things have taken place. We're talking to California about different sites, but we can have a lot of units up fairly quickly if we think we need them. I think what I'll do is I might ask Seema to say a few words on the telehealth, and then we can get back to this, please. Seema?
Thank you, Mr. President. And as the President announced earlier, we are doing a dramatic expansion of what's known as telehealth for our 62 million Medicare beneficiaries who are amongst the most vulnerable to the coronavirus. And we're acting in accord with the appropriations bill that was signed on March 6th, as well as the President's emergency declaration last week. And this action is a part of our broader effort to ensure that government requirements, rules, and regulations don't get in the way of patient care during an emergency. And today's announcement builds on the significant progress that the President has already made over the past 3 years around telehealth services. And while we have allowed for virtual check-ins, full telehealth benefits have been restricted to those living in rural areas, established patients, and just for those brief visits. But no longer, Medicare beneficiaries across the nation, no matter where they live, will now be able to receive a wide range of services via telehealth without ever having to leave home. And these services can also
These
be
telehealth
provided
programs, I didn't know of telehealth in particular, but other versions of it. I think that this is the next generation of how you get treated. There's always going to be ways, whether you have maybe like an Apple Watch or something that can track your heart rate. I think anything fitness and health will get better and better, where you can actually get more information from yourself to your doctor without leaving your home. And that would probably be the best, because I remember when I was sick growing up, going to the hospital, and actually I think I did catch chickenpox. By going there, it would have been better if I had just dealt with my cold on my own here at home.
So with our new telehealth benefits,
wholeheartedly agree with that.
This person who's not really, who's at risk for the coronavirus doesn't have to venture outside their home. They can talk to their doctor.
And of course, key with this, if you don't know if you have the virus, then you don't have to expose yourself to it if you don't have it, or you don't expose others if you do. But I'm not sure how this testing can be done without it. There's no way to take the test. Maybe you mail it in. That's a long time. I don't know. I guess the telehealth would only be for not testing for the coronavirus.
Clinicians and providers who over the coming weeks will face considerable strain on their time and resources. And now Medicare patients who don't absolutely need to come in to an office won't have to. And this allows the healthcare system to prioritize for care for those that are that have more needs or in dire need, and preserves protective equipment as well. State Medicaid agencies can also provide telehealth services without federal approval, and so we're asking all states to make this available as well. And we've also asked private insurance companies to expand their telehealth benefits and make it clear to their providers and their members what they cover. As our nation seeks to balance the twin imperatives of getting Americans the care that
See, one thing that I've seen, whether it be something like telling insurance companies to do something or telling people that there is a curfew, there's a lot of strong talk being made. And the thing is, like, none of these are becoming laws and regulations. There may not be, let's say in New Jersey where I am, there may not be a hard curfew from 8 p.m. to 5 a.m., but it's a strong recommendation, because these things are so much easier to get by and to make the public known than having to write something up, pass it. It just takes so much longer, or just even to announce it. A strong recommendation, if followed, I think is the best bet, because I hope people understand how serious this is.
There may be some of our Medicare members that may not have access to equipment, so we're asking family members to help with this, but also respecting the requirements around social distancing, and if any of those family members or neighbors have symptoms, they should obviously stay away.
Will you be posting numbers also?
That's correct.
That might
exactly.
be the easiest way to do it.
Yes.
If you post in ads, if you post some numbers.
And they can also call our 1-800 Medicare number, and they can also get information. Those phone lines are open.
Thank you. Thank you very much. Admiral, if you'd say a few words about where we're going, and then I'd like to ask Dr. Burks to say a couple of words about how
All right, guys, if you're interested, there's going to be presidential addresses. There's going to be addresses by mayors and governors all over the country. A lot of them are on Facebook. That's actually where I got this one from USA Today. But you can find them on YouTube when they're actually live or when they have been recorded. And there's a lot of good information. I'm suggesting everybody look to the World Health Organization's website and the CDC's website, Center for Disease Control, because those things will help you out greatly. The reason why I wanted to make this quick reaction video was the stimulus package to the actual people. So the infrastructure, in my mind, that has to stay, that has to be protected, always protected, but also the people have to be protected too. You can't just save the structure and then leave people to pull out loans and to help themselves and to not recover for a long time. They both need to be in conjunction, and that's what people don't like. The structure and whatever system we have going on with, let's say, airlines or restaurants or trading stocks, that system has to endure, but the people have to endure. And I believe they are of equal importance, because if the person survives and the system is not, then what can you do? It'll take so much longer, I think, for a system to kick back up. But of course, people just can't be relied on to pull out loans and dig themselves into debt because of a situation that's completely out of their control. So if you want to find out more about this, I would say do your research, check, make sure you're looking at the right information. But considering this is a press event from the White House, it's a presidential address with a lot of the advisory board around. This is most of the information that you're going to get here, and most that people will see. Hopefully there's not too much misinformation. If you have any questions or comments, leave it in the comments section below. You can begin a dialogue with myself or anybody out there. I'm going to be doing videos like this just because it is something that I've been interested in a while, and I've been trying to stick my feet into politics and just kind of world events. So again, key things to take away are there is a plan to give money to people. They're saying $1,000 by check. We'll see what exactly that plan turns out to be. And I'll be making more of these. You can find me on Instagram at M8B9. You can email me at matt8b9@gmail.com. Thank you so much for watching, guys, and I'll see you next time.